Hi, everyone. Good morning or good afternoon, depending on where you're joining us. It's good to have you with us today. Next slide, please. Welcome to today's webinar, Using Psychiatric Rehabilitation Strategies for Long COVID Recovery. And this is part 1 of 2. This webinar is sponsored by the Northeastern Caribbean Mental Health Technology Transfer Center, or MHTTC, and we're housed at Rutgers in the School of Health Professions in the Department of Psychiatric Rehabilitation and Counseling Profession. My name is Gati Rivera, and I'm the project coordinator of the center, and we'll be introducing our presenters and our webinar today. Next slide, please. The MHTTC is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, to enhance the capacity of the behavioral health workforce to deliver evidence-based and promising practices to individuals with mental health conditions. We also address the full continuum of services spanning mental illness prevention, treatment, and recovery supports. We also offer training programs in evidence-based practices for serious mental health conditions, wellness and recovery for providers and people with mental health conditions, school mental health, Hispanic and Latinx mental health education, and online education courses such as Wellness Matter, illness management and recovery, and functional thinking, and more. Next slide, please. Oh, next slide. As a reminder, all of our training programs, products, and services are available to you at no cost. Next slide, please. If you're interested in staying up to date with the events and products that the Northeastern Caribbean MHTTC is providing, we ask that you please sign up to receive our email communications. You can simply scan the QR code that you see on the screen, and it will take you to the page where you can enter or register for our email list. Next slide, please. Following this webinar, you'll be asked to complete a brief survey. We value this feedback and use it to improve our activities and inform our future activities. These surveys are also important because our continued funding is linked to the completion of them, so we thank you in advance for your participation. Next slide, please. We also want to let you know that this webinar will be recorded and posted on our website and be available on our website within 7 days of this webinar broadcast. Next slide, please. This presentation was prepared for the Northeastern Caribbean Mental Health Technology Transfer Center under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, or SAMHSA. All material appearing in this presentation, except that taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permission from SAMHSA or the authors. Citation of the source is appreciated. We ask that you not reproduce or distribute this presentation for a fee without specific written authorization from the Northeast and Caribbean Mental Health Technology Transfer Center. At the time of this presentation, Marian Delphin-Rittman served as Assistant Secretary for Mental Health and Substance Use at SAMHSA. The opinions expressed herein are the views of the speakers and do not reflect the official position of the Department of Health and Human Services, or SAMHSA. No official support or endorsement of DHHS or SAMHSA for the opinions described in this presentation is intended or should be inferred. Next slide, please. We encourage you to interact with our presenters during the webinar by using the chat feature. Please post any comments or questions you have in the chat, and I will collect your questions as we go and ask them of the presenter during the Q&A time toward the end of the presentation. During this webinar, our presenters may pose questions or polls to you, so please use the poll function or the chat feature to answer them. Next slide, please. As a reminder, the MHTTC network is committing to using affirming, respectful, and recovery-oriented language in all activities. Next slide, please. We also want to inform our participants that SAMHSA has launched the 988 Suicide and Crisis Lifeline for people experience suicide, mental health, substance use crisis, emotional distress, or if you are concerned about people, someone in crisis. Excuse me. Next slide, please. Now let's begin our webinar. We have Dr. Michelle Zechner and Joni Dolce with us today. Dr. Zechner is an assistant professor at Rutgers in the Department of Psychiatric Rehabilitation and Counseling Professions. She's been working in the areas of health, wellness, and self-care strategies for over 15 years. Her work has centered on helping people living with mental health conditions, their family members, and the staff who support them. Dr. Zechner has worked in a variety of settings, both community and inpatient mental health settings, nursing homes, and in-home services. In her current role, she works with a wide range of mental health professionals, providing consultation, building staff resilience, and flourishing. She also teaches students and conducts research on motivational health and wellness practices. Joni is an assistant professor in the Department of Psychiatric Rehabilitation and Counseling Professions at the Rutgers School of Health Professions. Joni has several years of experience working in behavioral healthcare settings, namely supported employment. Joni teaches courses in the department's undergraduate program, as well as providing training and technical assistance to behavioral healthcare providers. Her research interests include staff training and employment services. She presents nationally on the topic of employment services and is listed as a Society of Human Resource Management recommended speaker on the topic of creating workplaces that support mental health. Now, again, I'd like to welcome everyone to our webinar, and I will turn it over to our presenters.
Thank you so much, Kati. Welcome, everyone. Here in New Jersey, it's a pretty rainy, gloomy day, so hopefully you're all experiencing some nicer weather or enjoying the current weather. So we will get started with looking at our objectives. We're going to spend a little bit of time defining what long COVID is and talking about related symptoms and functional implications of long COVID. We're going to review some of the current research on the impact of long COVID on mental health. We're also going to look at the benefits of using a recovery framework when we're addressing long COVID, and finally applying concepts that we're talking about today to your work experiences. So just to kind of preface this series, this is one of two. Michelle and I created this two-part series to really look at, initially today, some of the research, kind of looking at what is long COVID from our perspective of psych rehab professionals. And then next week, we're going to follow it up with really looking at specific psych rehab strategies, other supports kind of within that psychiatric rehabilitation framework of how we can assist individuals that you're working with who may be experiencing long COVID symptoms. Today, we're really focusing on kind of that overall discussion about long COVID, the research, as well as looking at a recovery framework. And when we talk about recovery in this sense, we're really talking about mental health recovery. So just to give you a little bit of an idea, again, if you have colleagues who can't make it today and would like to join us next week, they aren't really building on one another. We'll refer a little bit, but we'll provide a little bit of an orientation next week if individuals may have missed it. But it looks like there are a few things going on in the chat. So Kati, if there's anything relevant to the presentation, please just let us know. And we have a smallish group today, so please interact, use the chat like Kati mentioned, raise your hand if you want to unmute your mic. We're going to have some interaction throughout, so we really encourage that. And Michelle and I, as we were developing this presentation, we really feel that behavioral health providers are in key positions to help individuals work through some of the long COVID symptoms that, as we discuss in detail what they are, really do mirror some of the symptoms and functional implications of serious mental health conditions. So before we get into some of this core content today, Michelle and I wanted to reinforce kind of the enormity of what we're talking about, not just the pandemic itself, but really this ongoing impact of the lingering long COVID symptoms that people are experiencing. Michelle and I will be presenting today from our psychiatric rehabilitation perspective. And that's why we've included lots of resources and references related to ongoing scientific research that's currently being done. So we're really kind of focusing today on our experience as psychiatric rehabilitation practitioners, educators, trainers. So you can see here the enormity, 98+ million cases of COVID in the US, and the CDC has done a lot of work around this that we'll be referring to and also providing as resources. 1 in 5 individuals experience symptoms after the acute illness. The CDC is using several different ways to estimate the amount of people who are experiencing long COVID symptoms. So just to look a little bit at the research, the CDC is looking at self-report of long COVID symptoms. They're looking at medical records of patients, and they estimate the estimates of the proportion of people who had long COVID, or it may also be referred to as post-COVID, that go on to experience these conditions can vary, but some of the research or data that they have is presented here. So about 13% at 1 month or longer after infection, 2.5% at 3 months or longer, more than 30% at 6 months among people who were hospitalized. And this is just, again, from our perspective as psych rehab practitioners, just to present with you some of the enormity, some of what's this is significant. And there are lots of research projects going on. The National Institutes of Health is currently conducting, or they have been conducting, the RECOVER study, and we have it referenced in the back as a resource. But the RECOVER study is designed to increase understanding of long COVID or post-COVID and provide information to develop new ways to diagnose, test, assess, treat long COVID symptoms. So there is research being done through the NIH. And again, our resources will have that listed, and you can get some additional information about what that is. But it's this ongoing research project that they're continuing to look at the impact and the gravity of long COVID symptoms. Long COVID is really defined as these lingering symptoms that many people continue to experience well after they've recovered from the illness itself. The CDC, again, has lots of resources out there, and long COVID, not everyone who has COVID will experience long COVID symptoms. However, as we begin discussing what those symptoms look like and the functional implications, how they actually impact people's functioning, you'll begin to see that it's significant for the people who do experience long COVID. Some of the symptoms are listed here. We added the symptoms that there are certainly many more. Again, from our perspective in the rehabilitation, particularly psychiatric rehabilitation field, these are the ones that we might be seeing with individuals that you're working with, and actually being able to address and apply some of the strategies of psychiatric rehabilitation or other rehabilitation or behavioral health strategies. The experience of many of these symptoms may affect the attainment of important recovery goals, such as working or attending school or socializing or living independently, or someone's overall well-being. So it's really important for us in behavioral health to be paying attention to some of these symptoms. You may see individuals who experience these symptoms directly related to the mental health condition that they may have, or these may be symptoms that you're beginning to now see that may be classified as long COVID symptoms. And I should mention that long COVID is a disability under the ADA. I think July of 2021, the ADA recognizes long COVID as a disability. However, to really assess if someone has long COVID, certainly that would be up to the provider or other means of assessment. But these are symptoms that greatly impact those attainment of recovery goals. Some of the physical symptoms, someone might feel tired or fatigue. Respiratory, of course, symptoms are also long COVID related. Neurological symptoms in terms of concentration or thinking, brain fog. So someone may have, difficulty remembering or understanding or, really thinking through. Depression and anxiety are considered long COVID symptoms. Problems with sleep and executive dysfunction. So problems with executive functioning. And when we talk about executive functioning, we're really talking about those cognitive and mental skills that help us to work toward goals, such as going back to work or going back to school or socializing or increasing our well-being. Executive functioning skills direct our actions and behaviors. They prepare us for future situations or future experiences or attainment of future goals. And when people have difficulties with executive functioning skills, they have problems organizing their behaviors or, working towards, or even you might see different aspects of someone's motivation to work towards accomplishing some of their long-term goals. So if you think about working in behavioral health and behavioral health settings, certainly in the impact of long COVID on executive functioning skills is really significant when we're really working with people to assist them in achieving recovery-oriented goals or wellness-related goals. So we really want to be able to acknowledge and assess how can we assist someone who might be experiencing executive functioning limitations or difficulties? How can we assist someone who might be experiencing sleep problems or increased anxiety because of long COVID? And certainly you can use a lot of the skills that we're going to be talking about despite someone having long COVID symptoms. As you can tell, many of these symptoms listed here could be symptoms related to a mental health condition or other conditions. So Kati's going to pull up our first poll. Have you seen people that you're working with experiencing long COVID symptoms? Just a simple yes or no. So it looks like yes, about 60%, 67%, 33%. So many of you, it looks like, have seen people. You're working with people. You're maybe even personally, you've seen people with the experience of some of the long COVID symptoms. About 20% of you have not seen anyone, but with some of the research that I was looking at and some of those ongoing research studies, I think that it's likely that you will encounter individuals that you're working with some of these long COVID symptoms. So the poll has ended and I'm going to share the results. Okay, it looks like, Kati, can you share? Or I know it said it blocked me from sharing it, but.
Yes, it's shared.
Okay, great. So about 80% yes, 22% no. So, this is something that you're seeing. You're seeing people with long COVID. And then our second poll here is approximately what percent of people that you've seen are experiencing long COVID symptoms. So if you are seeing people with long COVID symptoms, what percentage? 25, 50, 75, more than 75, so about 75%. Okay. So if you're seeing people with long COVID, you're seeing maybe 25%. About half of you so far have answered. 25% of individuals that you're seeing with long COVID. Kati, did you want to share the poll? Yeah, so a fair amount of people that you're seeing are experiencing long COVID symptoms. Thank you for sharing that information and participating. So we kind of established that a fair amount of you are seeing individuals who are experiencing long COVID. There's some percentages ranging from 25 to 75% of folks that you're working with. Use the chat, or you could even raise your hand and unmute and Kati will unmute your mic. But what are some of the symptoms of long COVID that you have noticed with people you are working with? Think about what we just reviewed: brain fog, thinking or cognitive issues, executive functioning concerns or difficulties, tiredness, more fatigue. So you can use the chat, and Kati, if you wanted to just read off in the chat what people are saying, but we'd like to hear what you're actually seeing out there in the field.
So if you'd like to speak, I can unmute your mic, or if you'd like to share, you can also type in an answer in the chat box.
Yeah, we'll give a minute or two to give people time to write in the chat. But what are some of the specific symptoms that you're noticing or you're seeing that people are experiencing?
Someone is sharing lots of fatigue, brain fog, some coughing and flu-like symptoms, less smell and taste loss with the Omicron as opposed to the Delta variant. Someone else is saying brain fog, fatigue, short of breath, headache, chest pains, and fatigue and overall depression. Everyone has seen loss during this time or experienced it, and many of us both. And depression, anxiety that accompany the physical symptoms.
Great, thank you. So it sounds like you're seeing an array of physical symptoms and also some of the more cognitive or neurological symptoms of long COVID, and some of the symptoms of that may not be related to the illness itself, like grief, depression, maybe anxiety, that may not actually even be due to having the symptoms related to COVID itself. Are there any more in the chat, Kati? I saw a couple more.
Yes, grief, loneliness, sleep issues, brain fog, pain, recurrent shingles as well, and pain.
So lots of symptoms that we're hoping over the next few minutes here today and next week when you come back, we can talk about ways as behavioral health practitioners or psychiatric rehabilitation providers, you may be able to help someone manage or address or support some of those symptoms. So Michelle's going to talk about the functional implications of long COVID. I'm going to advance her slides for her, but Michelle, if you wanted to take over.
Thanks, Joni. Yeah, I think, many of us probably are aware of this idea of functioning, like how we function every day. But when you think about it from a COVID perspective or from, medical perspective, functional implications or limitations, it's, excuse me, really about how well we live our life each day and what we do. And some of the science suggests that it kind of breaks down to a couple of areas that we're probably all very familiar with as working in mental health or behavioral health. One is activities of daily living. A lot of folks with long-term COVID experience muscle weakness or challenges if they've been, involved in the hospital for a long time. That might impact their ability to bathe themselves, dress, eat, or just sort of get around their living environment. Another one that I think a lot of you mentioned in terms of brain fog is cognitive functioning, which really does impact our thinking, focus, and attention and decision making. Those are all executive functioning tasks, which is really important to note that that is one area that's very commonly a challenge for people who live with serious mental illness, things like schizophrenia and bipolar disorder. So I kind of thought about it and I thought, folks may already be having some challenges. And then if they have the long COVID on top of that, it may really decrease their functioning or increase their functional limitations. Another area is physical functioning, which we talked a little bit about, but that's things like ability to walk distances or just take the stairs in one's house or stand. It might mean lifting light or heavy objects can be impacted. And these are also areas that are challenged, again, for people with mental health conditions before they have COVID. And if they have COVID, we may see some significant drops in ability. There's also changes in lungs functioning and breathing and respiratory issues related to COVID and long COVID. Excuse me. And it is pretty important to note that those are all related to breathing. And a lot of literature does suggest that people with breathing issues are more likely to experience anxiety. So we may also, in people with long COVID, see more anxiety, not only related to their situation and their losses, but also physiologically because of their lung capacity, which is important to remember. And in the fifth level, the last level of functioning that's often impacted by long COVID for many people is quality of life. And some of you brought up this issue of pain. So increase in pain, people may be experiencing insomnia or more sleep difficulties, difficulty with nutritional status, mood, and needing to return to work. So it's important to sort of know that COVID really does impact a lot of different areas in a person's life, and we're likely to see that. Of course, it may really be especially important for us as behavioral health providers because our service recipients or our clients, or whatever language we use, are often people who already have mental health conditions, and those folks are at higher risk for getting COVID and getting it very severely. Also, many people may experience greater issues related to COVID. As I mentioned before, they are already maybe having some difficulties, and with COVID, it may have another layer of difficulty. Also, we're really kind of in a great position, and we're going to talk a lot more about this next time, to support improved quality of life. I think that's what we do best in mental health and behavioral health services and education, is we improve quality of life by helping people with motivation, learning skills, and working towards a better life. And lastly, it's really important because a lot of people, whether or not they have a pre-existing mental health condition, are likely to increase it's very likely that they're going to experience some kind of anxiety, depression, or PTSD related to having long COVID, because folks who have long COVID are more likely to have been hospitalized, maybe intubated, have pretty extreme medical situations. So we do have to address that may be some kind of trauma as well. So there's a lot of reasons why this topic is important for us to consider. Next slide, please. So we have some examples here of the types of functional limitations or implications that may happen because of long COVID. And that might be the inability to concentrate or the brain fog. And what that actually looks like for a person, it could be having difficulty focusing on one task for a long time. Another functional limitation or implication could be decreased stamina, or not sort of being able to stand or walk or have the energy to go back to work or go back to school. And so that really impacts a person's day-to-day living. We talked about anxiety And the anxiety could really also impact, unfortunately, breathing and anxiety are sort of that, they work together, unfortunately. The more anxious we are, the less deep we breathe, and the less deep we breathe, the more anxious we get. It's a kind of a vicious cycle, but it also impacts our ability to concentrate and focus. And I did give you some examples of executive dysfunction and challenges with sort of planning and focusing and paying attention and remembering details, all of which are problems that people with serious mental health conditions often experience. Next slide, please. I did want to ask if you can think of any other functional implications. You could put those in chat. But I also thought, given that we know that folks are going to have, and you've seen clearly this audience, you've seen people with functional limitations with long COVID. How do you help, or how can you help people with long COVID cope with and recover from the experience? If you want to put that in the chat, we would welcome some of your thoughts about that. How might you help people with long COVID to cope? As it can definitely take some time to get over. I think there are a lot of parallels between long COVID and people living with mental health conditions. They're both complex chronic conditions. So I welcome any thoughts, if you'd like to put them in the chat, of how you can help people or how you have helped people with long COVID to cope. So while you're thinking, I guess we'll move on here. Next slide. Oh, thank you. Someone dropped in the chat CBT. Definitely. CBT is a wonderful way to help people cope and move through. And in fact, CBT is sort of one of the basis of chronic disease self-management. I don't know if people are familiar with some of those models that Dr. Lorig came up with to address things like diabetes and cancer. So definitely CBT and self-management strategies are really helpful. Next slide, please. So we want to introduce the idea, and I imagine we're all aware of this idea, really is this idea of recovery in mental health, because we're going to start here and then we're going to sort of move the parallel to people with long COVID. Recovery is that philosophy in mental health or substance use that people can and do get better with services. It's really a process of change by which a person improves their health and wellness, they live self-directed lives and strive to reach their full potential, regardless of whether or not they're experiencing symptoms of some kind. Typically in recovery, you've got a number of different areas, including health, home, purpose, and community. One of the earliest people talking about recovery was Dr. Bill Anthony from Boston. And in 1993, he had this great quote: "Recovery involves the development of new meaning and purpose in one's life as one grows beyond the catastrophic effects of mental illness." Now, if we just take a moment to pause and look at that definition and say, what would it look like if instead of mental illness, we put long COVID? Or maybe we would say mental illness and long COVID, meaning that I think that these ideas of helping someone move past long COVID symptoms involves the development of new meaning and purpose in one's life as you grow beyond the catastrophic effects of the illness. So Joni and I talked about this and we were like, this is a very interesting concept and something that we should be talking about in mental health. Anthony was really sort of a strong proponent, but recovery and psychiatric rehabilitation has continued to evolve since that time. And we think that some of the benefits of looking at COVID symptom recovery under this lens of psychiatric rehabilitation and recovery is that really psych rehab is a field that helps people recover, and those strategies about helping people cope and manage with chronic conditions is a really good fit for COVID and long-term COVID, because many of the challenges in long COVID and functioning are related to thinking and physical difficulties that are common for people living with serious mental illness. And I'm assuming that many of us work in mental health and are aware of the fact that many people living with mental health conditions die on average 12 to 20 years younger. They are likely to have significant comorbid or significant co-occurring medical conditions. So there's a lot of health and issues that are parallel. And in fact, some of the research that I've done shows that people living with mental illness, their physical functioning is about 20 to 30 years older than their chronological age. So these are very important considerations. So if someone has an illness that adds to that burden of thinking or adds to that burden of physical ability, we need to, really, I think that we're going to have to become more proficient at looking at this area. And I'm excited that we're talking about this area. And just as a way to sort of help us get a little clearer, recovery orientation is really about choices, empowerment, and agency, and the non-medication approaches to making oneself feel better. The medical model, on the other hand, really is important, but it highlights medical treatment or medications. And I always think about that as if I broke my ankle, God forbid, I would want to go to the emergency room. I really wouldn't want to talk to anybody about the psychosocial strategies I could use to cope with a broken ankle. However, once my ankle was set, and I had surgery or whatever I needed, then that long period of time where I wouldn't be able to walk in the same way, and I would really have to make some significant changes in my lifestyle, would really need a recovery sort of approach. And I think the same is true when we're thinking about mental health symptoms. Next slide, please. So we have an exciting activity that's coming up. Joni thought, I was like, oh, this is so cool. But we want to introduce you to the 10 guiding principles of recovery. These are from SAMHSA. They're available. They've got some nice materials. We've linked those in the resource section. But there are 10, sorry, is that 10? Yeah, 10 different areas in recovery that SAMHSA really focuses on. And it's things like hope, thinking that people can and do get better. And that would be things like if we're working with our client, we're maintaining that hope for them, that they will recover from their long COVID, that they will be feeling better at some point in the future. But it's not a linear process, right? It's sort of one step at a time. There's also many pathways, and that's how people find their recovery is unique. And that could be understanding what a client's strengths or values or preferences are, and also the things that might hinder recovering for them in this specific context. Also, recovery is person-driven. It's about self-determination and direction. So asking clients or service recipients what they want in their life, what their goals are, what values they have, and how we can help them move from where they are currently to where they'd like to be. And then peer support, which is just so important. It's so valuable for people, for all people, I believe, not just people living with mental health conditions. It's valuable for everyone to know people and experience mutual support by others experiencing similar experiences as you have gone through. And I wonder, I'm assuming now that we have self-help groups and mutual support groups for people with long COVID, which may be a great resource to consider. Also holistic. A holistic approach to recovery is really, I focus a lot on wellness in my work, and I think about holistic as encompassing the mind, body, spirit, and all of the different dimensions of wellness. So really asking clients and service recipients to think about how their long COVID symptoms are impacting them in different areas in their life, and also how those different areas might support them. And what I mean by that is things like their emotional well-being, physical, social, occupational, or spiritual, or any of the wellness dimensions. Culture, of course, is very important to our recovery, and those are the values and traditions and beliefs which guide how we move forward and cope with difficult situations. And we should be asking people how their culture can support them during these difficult times of coping with COVID and long COVID. And of course, addressing trauma is very important. Many people with mental health and substance use conditions have experienced violence, abuse, war, or other traumatic experiences, which increases the likelihood that they'll experience some kind of trauma and mental health challenge. And we need to know what that looks like in terms of long COVID as well. There may be other life circumstances that happened to them when they were younger that influenced their recovery, but there may also be issues around their health and medical situation around the COVID. If they were if they were in the hospital, if they were intubated, if they had aggressive medical treatment, that can be very traumatizing to someone. So understanding where that person is really important in terms of their recovery from the experience. Of course, we want to look at strengths to make sure that we understand the resources a person has in themselves or in their community, and we should be asking the person about those strengths. We want to focus on respect, and of course, we want to acknowledge the value of our client or of the person, but we also really want to encourage them to value themselves and have self-respect as well. And lastly, relational. And that principle is really around the social support that's so needed for all kinds of support and modeling of people who have good health and recovery, and we need that in our lives. So we really should be talking to our clients about identifying social support connections of the client and how they help the client and or service recipient, how they help that person move forward. So, that was a lot of guiding principles there, but I'm going to turn it over now to Joni so we can do this exciting activity.
You're hyping it up, Michelle. So yes, we did have an activity that we wanted to kind of get people involved with, looking at each of the recovery principles. I have those listed here. We were hoping to use the chat or even raise your hand and you can unmute your mic, or Kati will unmute your mic. But we wanted to look at each of the 8 recovery principles, and we can kind of go through that now, and using your chat or unmuting your mic, kind of identifying, you can pick one, let's look at hope and kind of this idea that Michelle talked about, how we as providers may be individuals in people's lives who are hopeful, and how we express that hope and optimism for recovery from mental health conditions or some of the long COVID symptoms and functional implications we talked about. What does that mean to you? So, you could write in the chat or unmute your mic. So think about hope, or if you want to look at person-driven, what does a person-driven principle of recovery mean to you, or peer support? So you can choose one of those 10, and it looks like something's in the chat already. And when we're going to do a follow-up next week, and next week Michelle and I really want that to be more of an applied, really talking about the strategies. Just to summarize today, we talked about using a recovery framework, looking at those 10 guiding principles of recovery to work with someone to help address some of those limitations due to long COVID, and some of the symptoms related to long COVID really mirror many of the symptoms that you may see individuals with serious mental health conditions. Michelle discussed some of those functional implications related to long COVID. And then in preparation for next session, we kind of got some of the information that would help you feel more prepared, namely maybe a deeper dive into the research around mental health recovery and long COVID. It looks like someone just raised their hands. Kim Shulman just raised her hand if you wanted to, some of what we talked about. And you can answer in the chat, or you could just kind of leave this as a thought of, thinking through after today, how might using a recovery framework support your work in helping people with long COVID? You can shoot us a chat, and if you want to answer it, or if you want to, again, kind of be thinking about it in preparation or just as a conclusion to today, how might using this framework support your work? And I'm going to go on as you think about that and see if anyone has any questions or comments. Thank you, Kim, for the question. And it looks like someone's writing in the chat, so we appreciate that.
So recovery is messy and nonlinear, not always a clear beginning or ending. And this is a great perspective or framework that I didn't think of, that covers a lot of different perspectives or areas. So they're, they're expressing gratitude. Yes, I see a double message, but
Great.
That's the feedback.
And then if anyone has any questions, please let us know. But I do want to spend a minute just reviewing the resources. Here are some of the references that we use with some links, and then these teeny tiny resources are listed here, but you can click on the links. But we have something from the Job Accommodation Network, the ADA. The ADA also has a whole section on long COVID that may be helpful for some of you or all of you. The Boston University has this document on functional implications and accommodations. So the NIH Recover study and so on. And then Kati, if you wanted to take over this piece.
Sure. Thank you everyone for joining us today. As mentioned before, we are funded through SAMHSA, and as part of receiving this funding, we are required to evaluate all of our training events, products, and services. So on your screen, you will see our evaluation QR code. You could simply hover over it with your smartphone and scan, or you can also access it through the link that I just provided in the chat box. Next slide, please. We also want to remind you, and if this is the first time you're hearing of it, we have a podcast toward wellness and recovery, and you can find it on Spotify, Apple Music, or Podbean. And it's titled Flourishing at Work, a helping plan for professionals. Next slide, please. And if you'd like to access our previously recorded webinars, you can do so by scanning the QR code that you see on the screen. It'll directly take you to our products and resources catalog on our website. Next slide. As a reminder, you will be receiving a certificate of completion for your participation for today, and that will be available to you via email within 7 days of this broadcast. And there's our contact information if you'd like to follow us on our social media channels on Facebook, Twitter, or LinkedIn. Or if you have any questions, you can always email us at northeastcaribbean@mhttcnetwork.org. Again, I wanted to thank everyone and thank our presenters for providing us with a wealth of information regarding this topic. We hope that this information was useful to you and in your work, and we hope to see you next week. Or I'm sorry, at our part 2 next week at the same time. And you will receive a reminder email if you have registered.
Thank you, everyone.
Thank you. Have a good day.